About today is the fact that we have 399 active cases of coronavirus across Victoria. That is the first time that we have had less than 400 active cases in our state since the 30th of June. And it's one measure among many of the amazing performance of the Victorian community. Staying apart but sticking together, making sure that we defeat this second wave, making sure that we continue to drive these numbers down. Because it's only if we get the numbers low that we can hope to keep the numbers low. And that's why I'm not only proud of the Victorian community, I am deeply grateful to the Victorian community for the amazing work, the sacrifice, the pain that they have endured and will need to endure for a bit longer in order to defeat this second wave and then open up and stay open. I'm very pleased to be able to report that there are just 16 new cases since my update yesterday. And 10 of those cases are linked to outbreaks in aged care. 4 relate to a complex case. 1 is linked to both an aged care outbreak and a complex case. There'll be further investigations by our public health team around those matters. I'm sad to have to update you that there are now 784 Victorians who have passed away as a result of this global pandemic, 2 since my last report, 2 males in their 70s. 1 of those is linked to aged care. We, of course, send our condolences and our best wishes to those 2 families. There are 51 Victorians in hospital. 9 of those are receiving intensive care, and 5 of those 9 are on a ventilator. There are now a total of 2,661,989 test results that have been received since the beginning of the year. That is an increase of 10,680 test results since my last update. As I always do, because it's so important, can I thank all of those more than 10,000 people who got tested the day before yesterday. It's such an important thing. One challenge we face, among many, is to make sure that we keep having the largest percentage, the largest number of people in Victoria who've even got the mildest of symptoms coming forward and getting tested. Not waiting a day, not waiting at all. If you've got symptoms compatible with coronavirus, then you need to come forward and get tested. That won't hold us back from opening up. In fact, that's what we want. We want to know where this virus is so that we can support you and your family and so that we can stop it spreading any further. What might hold us back is if we don't have people coming forward and getting tested. That's still a strong number, but we want everybody who's got symptoms, no matter how mild they are, don't delay. Please come forward today, visit one of the more than 200 testing sites across the state, and indeed, if you believe you have symptoms and you think you need a test and you can't get to one of those sites, we will come to you. This is so important that we have the most accurate, the most complete picture of how much virus is out there, how it's presenting, what are the stories that sit behind each of those positive cases, so that we can plan with that sense of steadiness and safety as we take these next steps. There are 4,273 cases with an unknown source. That's an increase of 3 since yesterday's report. There are 64 healthcare workers who are active cases. I thank them for their work. I wish them well. And I thank all of their many tens of thousands of colleagues who do quite amazing work every single day. There are no additional cases in regional Victoria. There are 9 active cases in regional local government areas under the 3rd step. The metropolitan rolling 14-day average as at the 26th of September is 22.1 for Metro Melbourne and just 0.6 for regional Victoria. Just quickly before I come to some other very significant announcements, for completeness sake, there are 209 active cases that are connected to aged care. There are 5 active cases that are connected to disability facility settings. Now, as each and every Melburnian knows only too well, our target today was to get to a rolling 14-day average of between 30 and 50 cases. The fact that we are, in fact, at 22.1 cases over that 14-day period as a rolling average means that this strategy is working. It's more than working. We are ahead of schedule. We have made more progress than we had hoped to make at this point in time. Now, that is something that we can all be pleased about, but it doesn't mean this is over. Today we're going to take some safe and steady steps. It's not everything that Victorians would want, but it is what is safe at this point in time. We are also in a position to speak in more detail about the approach we're going to take in October, but I'll come to that at the end. Each of you have a document that takes you through in some detail. Offline, we're more than happy to come to any questions that you have about any of those matters, and we're very grateful to you in getting that information out to the Victorian community. But if I can run through a list of changes, things that will change from 11:59 p.m. tonight. Firstly, 127,000 workers will return to various industries. Each of those industries will have a COVID-safe plan. You would remember that when we announced the roadmap some 3 weeks ago, we had hoped to have about 100,000 workers go back to work. We are essentially having 30,000, almost 30,000 additional workers go back to work from midnight tonight. That's exactly what we want. That is exactly what this strategy is all about. Opening up, staying open, being safe and steady. In terms of education, VCE and VCAL students will return for assessments from the 5th of October. This is for metropolitan Melbourne students, and indeed arrangements are already well announced in terms of the regions. Prep to grade 6, special school students and VCE VCAL students will return to on-site learning in the week beginning the 12th of October. So in Melbourne, ahead of schedule, we will be able to have all of our primary school kids back at school in the week beginning the 12th of October. I stress that it won't necessarily be every student in every year level on the one day. It may be staggered throughout the week, but in that week, beginning the 12th of October, Melbourne primary schools are going back to face-to-face learning. That, I'm sure, will be great news for many families. There are some medical issues and some research that's been done about infectivity amongst smaller kids, younger kids, and older students. And I think Alan or Brett can speak to that in just a few moments. Childcare opens for all children. No permit is required, and the 5 kilometre limit does not apply. In terms of in-home child minding, whether it be paid or unpaid, one childminder can do that in each home if that is the arrangement that best suits your circumstances. In terms of public gatherings that are outside, a household or a limit of 5 people from no more than 2 households will be able to gather outside for the purposes of whether it be meeting in a park, doing those sorts of things. That is more than what we had hoped to be able to achieve. It's not as much as people would want, but it is very important that we take those steps safely. Shopping, the limit on 1 person from each household going shopping just once a day is lifted, but I would just say, go shopping for the things you need when you need them. It doesn't need to be just a solo to 1 person any longer, but that is not an invitation, and I think common sense says this to every Victorian, it is not an invitation for an entire family group to go to the supermarket. That is not consistent with us limiting the spread of this virus. But the 1 person once a day is no longer, or from midnight tonight, will no longer apply. Care facilities and hospitals, 1 visitor per day for a maximum of 2 hours. Patients that are under the age of 18 years, 2 parents or carers can visit with no time limit. That is a significant shift, and it's a recognition that at times of great stress, it is really important to be able to be as close to loved ones as is safe. At the same time though, that's a broad rule. I think that it stands to reason that individual hospitals and in settings within hospitals, for instance, areas that are the most vulnerable, for instance an intensive care unit, may well have bespoke or individual arrangements. Each patient and their family, there'll be a contact person that they can speak to and have confirmed for them what the visitation arrangements will be. But in general terms, 1 visitor per patient for a maximum of 2 hours per day. I want to go through a couple of other health matters. Dental care, non-urgent services will be allowed with all dental surgeries, practices to have a COVID-safe plan. At the moment, that's urgent care only. That moves to more routine care that's not urgent of nature, but of course important. In terms of allied health and all the different specialties that are covered by that term, that may be provided in certain circumstances. There may be some face-to-face services that were currently not permitted. There'll be further announcements made and further detail provided about that in due course. In terms of faith-based activity, a limit of 5 people plus 1 faith leader for outdoor gatherings and ceremonies will be allowed. I know that is not necessarily as much as many in the faith community, people of faith and their leadership would want, but at this time that is what's safe, and we will continue to examine whether that can be expanded at the appropriate time. I do want to make this acknowledgement because I think it's very important. There are many people of faith in our community who have done it tough this year. They have not been able to come together and to worship together. That is a very important part of who they are and their normal experience. But it is simply not safe for us to go beyond that limit at this time. If we can go further, then of course we will, and we would make those announcements at that time. Weddings, a limit of 5, including the couple, and 2 witnesses in outdoor spaces will be allowed. At the moment, weddings are only allowed on compassionate grounds, so that is an extension. Again, not everything that people would want, but an extension beyond what we had thought possible. Outdoor exercise, and I know this will be of significant interest to many people, facilities such as tennis clubs, bowls clubs and golf clubs remain closed. Outdoor exercise without accessing a facility, so for instance hiking or fishing, that is allowed, but within 5 kilometres of your home, and with the 2-hour time limit applies. That is meaningful for some. I know it's not as much as everyone would like, but I'll come to when the next steps are likely to occur, which will give people at least a field of reference for how long these arrangements will remain in place. Given that so many people, 130,000 nearly, are going back to work, and there are already many people who are in permitted industries, we're also making a further decision that exercise will be allowed within 5 kilometres of your workplace, not simply your home. That is for permitted workers, and you must carry your permit while you do that, and of course the time limits and other distancing arrangements remain in place as well. Outdoor pools will open. There will be conditions around that, and we'll have more to say about that at the appropriate time. I want to now speak to the third step, and then there's one final matter before I hand to Professor Sutton. The fact that we are ahead of schedule, the fact that this is working, and we have done better as a community than what we thought we would be able to do by this point in time, means that I can announce that we will no longer be held for the purposes of the third step and the last step to the dates that we had indicated previously, essentially end October and end November. On the modelling and on the evidence, the data and the analysis of all of that, we believe that we will be able to take, all things being equal, the next step, which is when all the restrictions leaving your home, when there's much more freedom of movement, we believe that we will be able to take that important step on the 19th of October. We cannot take that step any earlier because, as I think Victorians have become only too well aware, decisions made today, the impact in terms of the spread of the virus will not be known to us for at least 2 to 3 weeks. The 19th of October is 3 weeks away, and our experts are confident that that is enough of the life cycle of this virus, given its latency, that is enough time for us to be certain that the numbers we see then are a true reflection of the impact of the announcements that I have just made. That is fully a week early than we had thought. We will no longer be talking in terms of dates, we will be talking in terms of case numbers. And when we reach those case numbers, provided it's not less than 3 weeks, we have to leave that gap. I know it's frustrating, I wish that were not the case. But this thing is silent, it spreads rapidly, and until you've waited that amount of time, you simply can't be certain about what the virus is doing. The other thing that helps us in making those assessments is, of course, people getting tested whenever they have even the mildest of symptoms. So we are at least a week ahead of schedule, but we must wait and see how things unfold over these next 3 weeks, and then make those decisions and speak about likely timeframes in November. This is a strategy that is designed to get us to a COVID normal Christmas. We are well on track. In fact, we are ahead of time when it comes to achieving that outcome. That is a credit to every single Victorian who is staying the course, working hard, making sacrifices. We have to get this done. We have to complete this task. There are no shortcuts. There's no easy way to defeat this wicked virus. We've got to do this right. And if we can stay the course, if we can just find it in ourselves to get this job done over the next 3 weeks, then we will be able to take even bigger steps on the 19th of October. I am proud of Victorians. I am grateful to Victorians. This is working. It is absolutely working. These numbers reflect it, and the decisions that we've made today reflect it as well. One final matter, tonight will be the last night of the curfew. It will be lifted from 5 a.m. tomorrow, and I want to make a very important additional announcement though in relation to that matter. Whilst the curfew comes off, that tonight's the last night, we have decided that a new fine, a penalty almost to $5,000, just less than $5,000, will apply for any unlawful outdoor gatherings or indoor gatherings. Victoria Police, the Chief Commissioner himself, will stand up tomorrow and go through some of the detail of this. But it mirrors the arrangements we've put in place for people travelling to regional Victoria and potentially taking the virus with them without a lawful reason. So if you're having a party at your house, that is not lawful. That puts everything at risk. And if a call's made to the police assistance line, and there's been many of them over these months, or if police are out on routine patrol and there are an inordinate number of cars parked out the front of your home, then you may well get a knock on the door. And the penalty will be no warnings. There'll be no $1,652 fine. It's almost $5,000. I can't make it any clearer just how serious this is. We are so close, so close to beating this thing, and it is just not appropriate to be going and visiting friends, to be gathering in car parks or wherever it might be. All the stuff that we saw some months ago, and we have seen to a lesser extent in recent times, that puts everything at risk. It puts everything that Victorians have done at risk. And Victoria Police will speak tomorrow in very clear terms. This is a very significant penalty. We don't make this decision lightly, but if no one has the right to put everything that Victorians have done at risk by going and potentially spreading the virus one family to another. Just finally on that point, I know people want to go and visit friends. I know people desperately want to be able to have that fundamental connection with friends and family. I get that. I understand that. But what I also understand, what I'm completely clear about, and the evidence is irrefutable, the home environment is one of the most risky environments. It is how, when people let their guard down, when there is a degree of informality, there is no distancing, there's not the cleaning at that kind of industrial level, that's when this virus gets away from you. And one big family or a small family visiting another and another and another does nothing but potentially spread this virus. Let's not have that happen. We are so close to defeating this thing. We've just got to stay the course. We've just got to get this job done. And I'm determined to do it, and I think the vast majority of Victorians are as well. In terms of these matters, the curfew and other matters, all of these matters come from the best of public health advice. It was a late night last night, very early morning this morning. That's the nature of these things. Having the most complete picture before you make decisions that can't be undone. We don't want to have to take any backward steps in this. And that's why these are steady and safe steps. Not as much as everyone wants, but it's what we can safely do to get the ultimate outcome. And that's that COVID normal Christmas. Again, I'm so proud of every single Victorian for everything that you're doing. And now I'll throw to the Chief Health Officer to speak to those decisions and that advice. And then I think that'll be fairly brief. And then we're going to ask Alan to come forward and take us through the modelling. And there are a number of different modelling projects that have been undertaken, including that research I alluded to in relation to younger kids and the relative safety from an infectivity and transmission point of view, which sits behind our primary school decision. And then we'll, of course, be happy to take any and all questions that you have.
Thanks very much, Premier. So to the decision around the curfew, really today's numbers are a little bit of an illustration around why that decision was recommended by my public health team and why I've accepted and supported the discontinuation of the curfew. If you take today's 16 cases, 15 of them linked to known cases, clusters and outbreaks. The remaining case under investigation, it may also be linked to known cases. That is a very different situation to where we have been in recent weeks, certainly even different to a fortnight ago when we had 50, 60, 70 cases per day. We're at a point now where the epidemiology is different, where the demographics of the cases that we're seeing are different. We always said that aged care cases would be a stubborn tail of this epidemic curve. That remains the case, but it does mean that a not insignificant proportion of our daily cases are in aged care, and a curfew doesn't address that transmission risk, obviously. So the sporadic, the individual community cases that we're seeing are now very small in number. Over the course of the last couple of weeks, we've talked about 21 mystery cases, but really we're getting to 1, 2, 3 community cases per day. And so in reflecting on the obligations of the Victorian Charter and the Public Health and Wellbeing Act and the issue of proportionality, it's my view, and it was the public health team's view, that the curfew is not a proportionate measure to have in place going forward. That's where we're at this point in time, and the new fines that will be in place from tomorrow night are really to focus down on that transmission risk and to be a reminder and an actual penalty for a breach of those stay-at-home directions where individuals might unlawfully gather in private homes. So the focus is absolutely very much on that behaviour, on that transmission risk, because that's an ongoing concern, and as the Premier stated, this whole strategy could fall apart if we don't hold the course on the very, very important aspect of limiting our interactions with others to those that are in this new step, which is 2 households or your own household, no greater than 5 people meeting outside. That is a very different risk to a private, indoor, unlawful gathering where indeed people are too close together, there's speaking and laughing and shouting and masks are not necessarily worn. That cannot happen at this stage. We'll get to a point where it can, but that is not now, and so those penalties that are going to be in place from tomorrow night are there to address that. But the curfew as a broad brush measure is not a requirement. I'll throw to Professor Cheng now to speak to the modelling. Thank you.
Let's have the next slide. So I thought I'd give you a bit of an insight into how we're using modelling and how we're using modelling to make some of these decisions. So a common approach to modelling is to give similar data and scenarios to different groups and see where they agree or differ. So we've been looking at 2 models about the historic glide path. So this is this effective reproductive ratio that we've been talking about. That's done by an internal group at DHHS and the Doherty group, and they show that there's an effective reproductive ratio of about 0.69 to 0.75, and this really suggests that the case counts have been falling at a rate of about 25 to 30% every 5 or 6 days. To try and predict how future policies might impact on transmission, we're using different types of models, and we've used an updated model from the University of Melbourne and new results from a model by the Burnett Institute, and they both predict that we're on track and perhaps even slightly ahead of where we thought we would be. There's still quite a lot of uncertainty about about the role, and this really reflects this role of chance. So a super spreading event like the ones we've had at Colac or Casey could easily put us back. These models are really best at describing or exploring what-if scenarios without actually having to live them. So, for example, the Burnett model was able to explore what was the impact of relaxing restrictions early. This suggested that we really can't open up too quickly. If we had opened up to the final step on the 14th of September, this model suggested that we'd have an 86% chance of a resurgence up to 100 cases a day within 4 weeks. If we opened up tomorrow to the final step, there'd be still a 41% chance of getting to 100 cases a day within 4 weeks. The University of Melbourne model now has been combined with work done by the Murdoch Children's Research Institute that has summarised Victorian and international data on schools. They found that primary school children are at a lower risk of getting and spreading infection. And this isn't to say that they can't get infected or they never get unwell, but their risk is lower. And it's particularly important when community rates of infection are lower, as they are at the moment. So where the first case in a school was in a child, outbreaks were much less likely. And 2/3 of school outbreaks were actually a single case with no onward transmission. So of the million students in Victoria and the tens of thousands of teachers in Victoria, there have been 139 staff and 373 students infected. This new modelling suggests that it is relatively safe to return students in primary schools in the first weeks of Term 4. For secondary school students, we're not quite so sure about the risk, and we're still doing further work on this. We still need to be careful, so schools will still need to be prepared. Parents and children will need to monitor their health carefully and not send students to school if they're unwell. Finally, I do want to emphasise that we're not relying only on models and not necessarily aiming just for a numerical target. As numbers trend down, the stories behind these numbers will become more important. The questions that our public health teams will be looking at will be just not only about the total numbers and are they low enough to relax, but also what is the chance that one of the currently active cases will go on to transmit. So how many contacts do they have? Are they isolating at the time that the symptoms started? Are there outbreaks in closed settings like aged care facilities? And then what is the chance that there are further undetected cases out there? So we're looking at things like testing rates, how many unknown source cases there are, and the characteristics of those last cases. So we're almost there. We do need people with symptoms to be tested so that we can find these last cases and act on them. And we just need to hang in a little longer just to make it as safe as possible before we can take the next step. So thanks very much.
Thank you, Alan. I'm happy to take any questions you have.
Premier, the outdoor gatherings of 5 people from 2 households, does that still have to be within 5 Ks?
Yes.
Can you?
Yes, that is correct. There is a change around exercise, which is related, but doesn't have to be exercise, those gatherings. There is a change in relation to workplaces, as I said. So this is my workplace. I would be able to go for a walk in the Treasury Gardens if I chose to, provided I had my permit with me. That we think is sensible because, particularly as the best part of 130,000 people go back to work.
And you're not allowing gatherings outdoors at private homes?
Well, I might ask Brett to speak to. It's a public gathering. We're not talking about a gathering in the backyard. There may be a time when we can do that, but it's a gathering in a public place, an outdoor public place.
So you have to go to the local park or
something of that nature, yes. And there'll be lots of different ways in which people will avail themselves of that gathering. But it gets very challenging, I think, if you were doing things in private homes. I think at this stage, I think it becomes very challenging for those events, those gatherings, not to become very quickly an indoor gathering where there is a very, very high risk. Let's be clear though, we hope, just 3 weeks' time, we are able to then say to people the reasons to leave, those reasons to leave your home, they go, and we can move to bubble arrangements that can include, potentially, can include people, one other family connecting without that prohibition on indoors. That's for another day. Indeed, that is not for today.
Can I just ask Alan what the modelling
Sure.
is showing in terms of the chances of being below that 5 number by October 19? How are we tracking for that?
Look, there's a lot of uncertainty. So we are tracking to about that mid to late October. But as I said before, chance starts to play a very large role in this, and one large event, one super spreading event, and it could be pushed back. But equally, if everything goes well and we get on top of everything, it could be around that middle of October time.
A lot of people have said that 5 number is unrealistic and we're never going to make it. Are you convinced we will?
Look, I think I'm trying to sort of emphasise that it's not really just that target. If it's 6 and there's a whole bunch of cases in hotel quarantine or in an aged care facility, maybe we'll be able to say that's okay. So it's not solely that target. There's a bit of wiggle room once we get close to that, but it really is an assessment of the overall situation. 5 is clearly the target, but there's a bit of flexibility there.
A pursuit of an effective elimination strategy?
I mean, the national aim, as spelled out by National Cabinet, is no community transmission. Even when there is no community transmission, there will still be cases in arrivals from other countries, and there may still be transmissions out there. When we get to 0 cases, like in the regions, we haven't had a case for a few days. There's always the risk that it gets seeded from somewhere else. There's always the risk that it gets seeded from Melbourne at the moment. There's also the risk that there's a case out there that we don't know about. So it's very important, even after these numbers come down, to be really vigilant and make sure that everyone gets tested, so we can make sure that that status is maintained.
Just to clarify, the trigger points, were those the ones on the original roadmap, just minus the dates?
Yeah, pretty much, yes.
Premier, just to drill down on the gatherings, if you wouldn't mind. Front yards, I assume, is in the same boat as what you're saying?
Yes.
Yep.
The Chief Health Officer is confirming for me up here in the front row that it's a public gathering. It's not in the front yard of your house, it's not in the backyard of your house. There'll be a time for that, and what I'm indicating to you is that on the modelling, we think that broadly, between the 12th and the 17th of October, we are going to meet our target. That's what the modelling says. However, as I've said many, many times, actuals always trump the assumptions in any model, and one event can change that. It doesn't mean you wouldn't get to the ultimate aim on or about the 18th, 19th of October, and that's when I hope to be able to stand here and make announcements about taking that 3rd step. It's 3 weeks. If we stay the course, if we take what has been safely given today, nothing that's been done today or announced today is unsafe. There were a whole range of other things we might have done, but the judgment was that could compromise the entire strategy. So therefore, we haven't done that. And I'm sorry that we can't go even further now, but to do that runs the very real risk that we just give back everything that Victorians have contributed to what's been an amazing effort.
Premier, what does the modelling tell you in terms of the lifting the 5K limit on movement?
I can't reflect on that specifically, but what I can say to you though is 5Ks, limiting movement, keeping people local, not having a situation where people are literally moving throughout from one side of metropolitan Melbourne to the other, that absolutely limits the spread of this virus. It'll be on no longer than it needs to be. It's not safe to remove it today, but all of those matters will be considered in some detail, and I would hope that we can get to that next trigger point in just 3 weeks' time, and we can have more to say about those things. So not only a greater freedom of movement in terms of distance, that's definitely an option, but also greater freedom because of the reasons to leave. There won't be a list of reasons to leave your home. You would be able to leave your home for all reasons, provided you maintained other COVID-safe rules like distance, the number of people that you were gathering with, so on and so forth.
Do you foresee that's going to be one of the last of the restrictions to be relaxed?
I don't think it'll be the last. I think there's every chance that it, and again, I don't want to speculate too much because you rightfully bank everything I say, that's nothing wrong with that, but we do have to be guided. We have to be guided by the numbers. We have to be guided, as Alan and Brett have said, what's the story that sits behind those numbers? How's the virus presenting? I think that we're a very good chance that those matters are no longer needed. Those measures are no longer needed. The roadmap speaks to that a little bit, but as we've seen today, we are updating that roadmap essentially because we are ahead of schedule. Victorians have delivered an outcome that's even better than what we thought. Even as ambitious as it was, People are staying the course, and this strategy is working.
What's the rationale behind dumping of the face shields rather than
Yes,
face
so we've had
masks?
quite a discussion about this, Rich, and I won't venture a medical opinion, but I think I can faithfully provide a summary of what the medical opinion is. Face shields don't meet the test of covering your nose and your mouth. You can wear a face shield if you want to, in terms of your eyes, but it would need to be accompanied by a mask, and we would recommend a 2-ply mask. But again, face coverings mask, anything's better than nothing, but a shield is akin to not wearing a face covering. You simply aren't. So there is a 2-week lag there, so we give people the opportunity to transition. People have been amazing with this. There's been a few cases of people who, for whatever reason, refuse to wear masks, but the vast majority of people, not just in Melbourne but in regional Victoria, they see it as, it's not something anyone's happy to do, but they see it as something that's possible, and you get a significant benefit from that.
On the face mask, are you looking at maybe next step that they could be eased for outdoor meetings, or are they in for the long term?
I can't make any announcements about that. We'll look at that very carefully. We do know, particularly as we get into the warmer months, that the degree of discomfort associated with them potentially gets higher, but the benefit is really clear. And it's something we can do. It's something that we can control. And even if the benefit were very small, the costs of it are so low that any benefit almost is of significance. So the other point here, Alan's spoken, and Brett as well over a long period of time, have spoken about chance, and how when you get down to these very small numbers and very fine margins for error, one event can make a really big difference. The thresholds, the tolerance is equally low. So I've said a few times, I'm a holdout when it comes to masks. I think they play a really important part, and I don't think they're not going anytime soon. But the exact circumstances in which they are best used, workplaces, for instance, or the outdoor question that you've posed, they're not settled, and I'll defer to the experts at the appropriate time.
Have you scrapped the curfew due to the legal action?
No. The Chief Health Officer has explained in very fulsome terms exactly why he's provided that advice to me.
On the mask.
And on that matter, that's on foot tomorrow, and that may well run. I don't know whether that case will still be heard. It may well be.
On the masks, do you have any evidence or a case where, I guess, a face shield has caused a case or anything like that?
Not that I can speak to. Brett is indicating that I don't think we can point to a specific, but I think there's a fair bit of international evidence, and there's also if you like, just the standing infection control knowledge that we have, that a mask is not as good as a mask and a face covering. A shield is not as good as a shield and a face covering. So it needs to be both. The shield alone does not work to the extent that we would like it to. Sorry if that.
And there's a 2-week.
Yes, there is, Alex.
So
It's 2 weeks, just so
weeks
people can adjust. We don't want people who are trying to do the right thing. We don't want them to be getting into trouble. And it is a shift. We had previously thought that was okay. We've now believe that isn't. That's the advice.
On the return to schools ruling,
Yes.
Will parents have to abide by the staggered starts that the schools choose to, or can people continue homeschooling their children if they so choose to?
I think that, well, Alex, to be honest, I think that individual schools, when coming to the arrangements that they think are best for them, they will consult with parents. I'm very, very confident that there'll be a proper discussion between the parent community, teachers and staff, and they'll come to an outcome that best meets the circumstances of that school. So on that basis, I would hope that no parent felt that those arrangements didn't meet their needs. But I'm very confident that we'll see attendance rates that'll be very, very close to what they were last year. That's actually, I think the Deputy Premier's spoken to this a couple of times, that where we've either at home or at school, even the distance that we've had kids signing on every day, and we've had attendance when school's been open that's been very, very close to what it was a year ago without COVID. So I would certainly hope. I don't have any primary school children in my household, but I can tell you from Year 8, Year 10 and Year 12, they're all very keen to get back. I've already given them the bad news at Year 8 and Year 10 can't go back now, but we'll assess that and we'll make some further judgments a bit later on. Our aim is to try and have them back as soon as we can, but primary school we believe is safe, and I'd be confident that schools will engage with parents to make sure that those arrangements, if it's not every kid on day one, they may take the week to get everyone back. Hopefully those arrangements can meet favourably with the expectations of parents.
Just on the hospitals and aged care, aged care, on visitors to hospitals and aged care, can you just explain that a bit more, why you're making that ruling?
So 1 visitor per patient for 2 hours. This principally relates, I think, to hospitals. Aged care is a slightly different set of circumstances, and I couldn't necessarily speak to some of the arrangements that have been put in place there. There are further measures, if you like, that are currently active in aged care, and they need to be, given how challenging it is.
Are there visitors though to aged care?
In some instances, no. In other instances, yes, there are, and there's a set of rules, but there's also a case-by-case basis. For instance, if there's a positive case in an aged care facility, that is an outbreak, and there'll be no visitors going into that one, I wouldn't have thought. And then there's also the transition issue where a number of residents who've been in hospital are moving back into their home. So I'm not wanting to confuse the matter. I'm just simply saying that they need to be very much... They're in a different category. They are higher risk than hospitals, and they need to take account of what the circumstances of that particular aged care facility is.
Is it a centre by centre type thing?
No. Well, there's an overall policy, which is an agreement. Again, we don't regulate this sector. But there's an overall policy, and then on top of that, further than that, some aged care facilities may make their own judgments based on whether the virus is in there, for instance. What we're talking about really here is hospitals. So 1 visitor per patient per day for no more than 2 hours. If it's a child or someone under 18, then there's a different arrangement, and we think that's appropriate. But what I'm trying to do as well, that's a broad rule, but it will be for individual hospitals to make judgments about particular settings. So, for instance, Simon, you would recall that there were some challenges in relation to coronavirus and the neonatal intensive care unit at the Children's Hospital some time ago. Intensive care units have throughout this pandemic had a very different set of rules, and it's been heartbreaking, absolutely heartbreaking. I'm privileged to know and to have worked with many doctors and nurses from those critical care settings, and they take their responsibilities incredibly seriously, and it has been, I know firsthand, it has been heartbreaking for them to be turning family members away. But when you've got a cohort of patients that are all literally critically ill, you've just got to err on the side of caution. So whilst this rule will apply across the board where it is safe, there will be some settings where hospitals will say, no, we can't have every patient having a visitor, even just the 1 visitor for 2 hours. That may not be deemed safe.
Premier, if we look specifically at these industry changes, the construction sees a partial return to work. What does that mean? Because obviously currently it's the 5 on site for the small sites and limited to 25% for sites over 6 storeys.
Let me come back to you on the exact specifics, but it's essentially in delivery of what we had said. That they don't, I think, account for any of the extra people. The extra people are principally in areas, for instance, and I anticipated that there might be some interest in this matter. I have got a note here. Let me just, when you get Meatworks and things. So in regional Victoria, meat and poultry will go across meat, seafood and everything in between. So those not doing a division between beef, lamb, poultry, so on. 90%, that's where they go to. In metropolitan Melbourne, though, they go to 80%, which is still a significant increase. But within that 80%, poultry goes to 90% because there are some in Metro because there's some significant animal welfare issues there. So with spring lamb, calving, and other seasonal factors, not to mention the fact that Christmas is coming, the busiest time of the year for all of our supermarkets, we are pleased to have been able to lift those percentages of workers, as well as supermarkets more broadly. They go pretty much to full tilt. That's been a long discussion, a very, very long discussion, and I'm grateful to all those industries for the way they've worked with us. But I'll try and get you a breakdown of the full 127,000 if I can do that.
Just staying on that, sorry. Why has it taken so long to have a difference between metro and regional for those abattoirs?
Because if I can take you back to, I think a similar question was asked to me at the time, why were we doing different things? We couldn't simply have a situation where all the work that would normally have been done in a high-risk abattoir, boning room, Meatworks in Melbourne, cool store, was simply moved to a similar facility in regional Victoria, because all that would mean is you created a high-risk setting in regional Victoria. So no one took any joy out of doing that. The industries work very hard to be as safe as they can be. We've seen some cases, but they're in a very different place today, and I'm grateful to them for the partnership. But having said that, I'm obliged to also make the point that all these arrangements and going back to something much closer to normal is predicated upon further testing, strict adherence to the COVID Safe plan, and that's not an honesty policy. We are out there checking. WorkSafe and others are out there checking. And the good news is they're finding industries that are doing the right thing. And it's been a very deep engagement. But we couldn't have a situation where we simply migrated the risk, if you like, from metropolitan Melbourne to regional Vic. This has worked. They are much safer than they've perhaps ever been from a COVID point of view. But we all have to be vigilant about that. And I'm really confident they will be.
Less than a day's notice isn't very much for all these industries.
Well, what's the alternative? Make a decision a week ago and then have to say today, actually, no, what I announced to you last week, which was not based on the most contemporary data, can't happen. So the notion of taking these steps will give people as much notice as we can. And in some circumstances, it's easier because we've got school holidays on at the moment. We can talk about the beginning of term 4, and yes, there is some notice. When it comes to these industries, my judgment, I could be wrong, but my judgment is I don't think too many of them will be complaining that this decision's been made. I think they'll be very pleased that this decision's been made, and they will work hard over the coming days to get up to the permitted level of activity.
Can residential construction, home builds, renovations resume tomorrow?
Let me come back to you on exactly where we landed, the exact specifics. I don't want to give you anything other than accurate information, but I'll get you the answer. I've been focused, if I might explain, I've been very much focused on those matters that have changed, not so much those that were foreshadowed in the roadmap 3 weeks ago. But I'm more than happy to come back to you.
And you mentioned the sole traders like outdoor gardening and
Yes.
landscaping. Now, can they work in teams if it's one
Now,
sole trader with an employee cutting grass elsewhere?
Now, I have to confirm no, and I want to make it very clear that we spent quite some time on this issue, because I have heard the matters that have been raised by this industry, particularly as it relates to safety. I asked the public health team to specifically consider this notion and potentially a bubble type arrangement where 2 people could work together to the exclusion of others, and that was deemed not safe. It was not something that the public health team could recommend to me. If we can change that, as soon as we can change that, we will. But they're back, but they have to work like everybody. Everybody who's come back to work is working in a different environment. Everybody has restrictions and limits. Everybody has planning and a different framework to work in. We will do as much as we possibly can, as quickly as we possibly can. And that very specific question, I had the public health team examine that, and the answer was no, and therefore I've got no alternative but to follow that advice, because that's the way it goes. You can't change that.
What does the data tell you in terms of bringing back hospitality in Melbourne, and
Yes.
particularly inside dining?
Well, you would note that we had foreshadowed that we would do principally outside dining, in effect really only outside dining in regional Victoria. Some time ago we were able, because of case numbers and a lot of hard work, a lot of analysis, that we were able to have 2 groups of 10 inside and a maximum of 50 outside. Now, I know that weather has not been particularly conducive to this in the last few weeks. That's the feedback I get from a number of people in this industry from regional Victoria. But what I'd say to all those publicans and restaurateurs and people who own cafes and bars, if we can get that arrangement, a similar type of arrangement in Melbourne, that's exactly what we'll do. If we can make a judgment that is safe.
Do you know when that could be likely?
Well, we will have more to say about that at the appropriate time, and we continue to have discussions with We continue to have discussions with all of those industries, and we know that people, you know, not just for their profits, but for their people, for their staff and for their customers, they want to get back. And we want them back as close to normal as possible, as soon as we possibly can. But the wicked nature of this thing is you've got that latency, that period where you just have to wait. Because if you don't wait, if your impatience gets the better of you, if you do it because it's what people want for the best of reasons, then you're doing it blindly. You're not doing it based on evidence. You are assuming that it'll work out okay, and that's not the way to do this. People have given too much for us to start winging it, as it were. You've got to be guided by the data, the evidence and the advice.
Did you say supermarket distribution will go back to normal?
Pretty much, yes. It's not just distribution, James. What we've done is we've kind of thinned it out, and they were allowed to spread the reduction across their whole setting. We've been working very hard with them. They've made a number of different changes around training, practices, all of those matters, so they get back pretty close to normal. But again, nothing about those workplaces, or indeed any workplace, is actually normal, because they've got to deal with a whole lot of COVID issues, so not having staff cohorting, trying to split shifts and all those sorts of things. But I think they will be pleased with where we've landed, and I want to thank Coles, Aldi, Woolworths and Metcash for the very constructive discussions that we've had with them.
And a couple of the other industries listed here, distribution, postal, we know Australia Post been having trouble, that's the same as well?
Correct.
On the outdoor gatherings, can the second household be from outside metropolitan Melbourne, for example, grandparents?
No.
See that show? No.
No, I don't think that's safe at this point in time. That will change. That will change, but there's already a caregiving. There's already a reason to go to regional Victoria, for instance, if you needed to, but we're trying to limit regional Victorian movement back and forth as much as we possibly can. If that can change, not necessarily in 3 weeks, but at a point of time earlier than that, we would always look at it. But the broader policy here is to stop the number of people moving from metropolitan Melbourne, where the virus is at a much higher level, into regional Victoria, where of course it is much lower, getting down to, you know, half a case per day. We're very, very close to that.
Premier, is bushfire preparedness a permitted reason to go outside Melbourne?
Not at this stage, but we will have more to say about that. There is an enormous amount of work going on around trying to finalise that. That is to say, our normal fire season preparedness. We'll have more to say about that quite soon.
Golf and tennis, you said the clubs weren't open, but are those activities permitted if you don't go through the clubhouse, if you like?
No, the facility, which includes, say, from perhaps the example I'm most familiar with, the course will be closed. Not just the clubhouse, the course will be closed for another 3 weeks. It is my view and my hope that we will be able to make a change to that in about 3 weeks' time, and then not have to further restrict that activity ever again. We would be able to make that change and lock it in. It's just too early for us to do that now. The alternative, if I can just, again with the example I'm most familiar with, not to turn the whole press conference into a discussion about golf, but if you said, okay, you can go and play, but you can't play any more than 5 k's away from home, then we will finish up with large numbers of people compressed into a small number of courses, many of which are public golf courses that don't necessarily have the staff and the ability, I think, to be able to manage that. You're creating an opportunity, or creating a further opportunity for a large crowd to gather, and that just doesn't make sense. The 2-hour limit would, of course, apply anyway. So I think it is much better, rather than giving some very small but quite complex and potentially dangerous things today, we wait the 3 weeks, and then we can go back to something that's very, very close to normal when it comes to those activities. That's different, though, to activities that don't require a particular facility. If you can go fishing on your own within 5 k's, then you can go and do that. If you want to go for a walk or a hike, those types of things, then that's something that you can do. But facilities are closed, and I know that will not be what many people want to hear, but that, in the judgment of the experts, that's safe to do now, but it won't be there forever. We will hopefully be able to make that change away from that in about 3 weeks.
The 3-week timeline, does that give us the opportunity that grand final weekend might be a bit of a reopening weekend for Melbourne. We might be able to have a few
Well,
more
that's
readers over
certainly,
pub.
the 19th is ahead of that weekend, yes.
Does that give you some optimism? That's something to look forward to?
Oh, look, there are many things to look forward to. There are many things to be very, very optimistic about. Victorians have done but still need to do an amazing job. We can't just say, right, these numbers are low, it's done. It isn't. It's not. It'll come back with fury. It will run wild if we just let this go. If we pretend it's over when it isn't, then we will finish up in a very, very difficult circumstance very quickly. If we can just find it in ourselves, all of us, just to get the job done. 3 more weeks, and then we can take a significant step. It's not the final step, but it is a significant step, and it's a big step back to normal. And a normal, a COVID normal, that we can lock in and defend and maintain, not just for weeks or months, but potentially for the entirety of 2021.
Have you spoken to other premiers and the Prime Minister about where we're at now and whether they can open up borders for regional Victorians to jump into New South Wales, for example?
No, not specifically, Rich, in relation to what I'm announcing today, but I'm very pleased to see that Premier Berejiklian has made some comments around much greater, a bigger bubble, as it were, that the freedom of movement between much more of regional Victoria and southern New South Wales. I think that we will get to a situation where perhaps there can be much greater movement between regional Victoria and New South Wales, regional Victoria and South Australia. Our borders are open. These are matters for other states. But as I've said many times, and I will say it again because it's just the fact of the matter, the best thing we as a state can do, every one of us, is get these numbers low and then keep them low, and that's when we'll get the borders open.
Any updates for the fitness industry, Premier? Is there any changes for the industry in step
The
3?
foreshadowed outdoor boot camp type arrangements, they are, we can confirm those, but nothing beyond that. And I know that won't be, that's not what that industry wants to hear, but it is, in the view of our experts, as we've explained many times, that simply can't be, it's not an environment that can be made safe at this point. We do hope that can change at some point in the future, but it's all about all the issues we've talked about, the number of cases we've got, the risk that we have to deal with in a broad sense.
When you mean at this point, you mean step for looking
Correct.
at October? Like steps?
No, well, I'll announce October steps in October. I'm announcing the 28th of September stuff today.
Sure.
So there's no change to what was forecast.
Right, so but obviously the industry wants to plan. Is there any view
Well, we would
of
give them,
things changing
not inconsistent with what I just said, in terms of planning for Meatworks and things of that nature. We'll try and give people as much notice as we can, but I cannot announce today what the settings will be, other than what we've already said in the roadmap, the original roadmap. I can't make any further announcements in relation to gyms.
Just to clarify on the indoor sporting arrangements, the dance community, which is obviously very vocal, have pointed out that young children are not a risk, and they're carrying out current classes for schooling. So will they be allowed to carry out classes for children?
I don't think we've settled that matter. We're still looking at that matter. That has been. Sorry, let me be really, really clear. I'll tell you what I know rather than what I think has happened. I know that the public health team has been looking at this issue, and it started with those kind of professional dancers. They looked at that issue because it was a matter of work, Australian ballet, things of that nature. I know that they were looking at this matter in the example you cite, Alex. I don't know whether that matter's been settled. It's not in my brief to announce today, so I expect it's not. But let me double check. That it's not about the fact they're vocal. There are many vocal groups, many. It's just about working through methodically what risk does that pose. Could we do it? If we can, we will. But I don't believe I've got an announcement to make about that today, but let me chase that up for you.
If they can, just a larger question, just
Sure.
going back to one that didn't feel to me like it got answered. Has the policy on whether there is or isn't zero transmission, or whether there is or isn't only zero community transmission, where's that at now?
There's no change to those settings. They are a function of the National Cabinet agreed, reconfirmed on multiple occasions under all the different roadmaps or plans that have been put forward. This is an aggressive suppression strategy. There will be cases in 2021. There will be outbreaks. We are not looking... And suppression versus trying to eradicate the virus is not just about the numbers you get to, it's what you do when you get a case. So New Zealand had for a long period of time no cases. When they got a very small number of cases, they closed the place down, or at least a large part of it. What's different here is we aim to get the numbers as low as we possibly can, because it's only unless you get them low that you can hope to keep them low. But when the inevitable cases come forward in December or February next year, we won't necessarily. That doesn't trigger the instant re-imposition of some of the restrictions we're talking about here. There is a tolerance there, and that's why we have to be ready, and the numbers have to be low in the first instance. You can chase 5, 10, 15, 20, chasing 100 cases a day and all their close contacts, with a replication rate that's well over 1. So every person that's got it's giving it to at least one other person, and maybe even more. That's what France is dealing with at the moment. 14,000 cases yesterday. We can't have that happen. But there are differences, and it's almost what you do when you get a case. That's what defines. That's one of the differences.
Is Victoria still chasing the limit of?
Correct. The numbers that we outlined. But I would just say, Alan and Brett have made this and I've tried to as well, over a long period of time now. Numbers are important, but the narrative that sits behind those numbers are important as well. If there's, on a given day, 10 cases, and that, say in a month's time, and they're all in aged care, and we've got it locked down, we've got our arms around that, we know exactly who it was, who their close contacts are, we've got a degree of certainty that it's not going to run because of those numbers, then they will be looked at differently. That's just a common sense approach, and it is because you get the numbers down, you can have both contact tracing and analysis downstream, so where the virus is spread, but you can look upstream as well and have a greater certainty about how the person got that virus. So you just get a more complete picture, which is only really possible when you've got numbers that are much smaller than, say, where it was 6 weeks ago, where there were 725 cases.
Can I ask the Health Minister his first question as Health
You
Minister?
absolutely can.
How quickly are Melbourne hospitals going to be able to get up to the 75% of elective surgery capacity?
So as per the roadmap, they will go through their processes of engaging with their specialists, with their patients, and as quickly and as safely and in a COVID-safe manner, they will get to that point as soon as they are able.
Given this was flagged a couple of weeks ago, do you expect that will happen within the next 2 days or so?
It will certainly happen within the COVID-safe environment, and it will vary from hospital to hospital, and it will vary between the public and the private sectors because they've all got different cohorts. So it will be done in a safe, careful and sustainable manner to make sure that those facilities are safe for the workforce, for the patients, and that those patients get their surgery as soon as it is safe to do so.
There has been concern among the health industry, or basically doctors themselves and surgeons have been saying that there's no incentive for surgeons to assist in helping the blitz be carried out. Is there anything that's changing to try and...
Well, of course, I've been in the job for not quite 15 hours. I'm happy to sit down with, and I've already had some initial exchange with the AMA, and I look forward to sitting down with all of the colleges. I look forward to sitting down with them and working through these processes in the safest, most appropriate manner.
Just on the industries allowed to go back to work, one for you, Mr. Foley or the Premier. You said here that sole traders can go back to work, certain sole traders, gardening, landscape, garden maintenance. What about, painters or, chippies working on their own, that sort of thing?
I'll defer to the Premier.
Okay. Sorry, Mr. Foley, to do that to you again.
And if you'll, with your indulgence, Simon, given the very lengthy night that it was last night, let me come back to you.
Thank you.
If you're okay with that.
Yeah,
Premier, just on this, has the need to change the Health Minister affected what could and couldn't be changed?
Not at all. Not at all.
How is that the case?
Well, because the decisions are not made by one person, and the public health team have gone about their work. All of those ministers and their officers, many other officials within the department have all been very, very focused on this issue, not for a day or a night, although it was a long night, but throughout, not just this week even. These are additions to a roadmap that I announced 3 weeks ago. So there's no impact whatsoever.
Premier, with the 5K limit.
Caucus says that she tried to call you yesterday before sending that text message. Do you know if that call came through?
As I indicated yesterday, I think I indicated yesterday, she first called, I was on the phone, and then I got a text message only moments thereafter. There was no voicemail message, and it was just to inform me that a letter had been sent to me via my Chief of Staff, but that was after the event. The resignation had already been made.
Premier, with the 5K limit that's staying, obviously, can you talk us through the health advice behind that decision, please?
The 5K limit?
The 5K limit.
Limiting movement limits the spread of this virus, and keeping people local into their local community is very, very important. Again, Noel, it won't be there any longer than it needs to be, but it's not safe for us to take that off now.
Following the departure of Jenny, obviously there's a lot of people within your government that are sad to see her go and sad about things in general. Have you had a meeting with the caucus in general to discuss Jenny's departure, or will you be speaking to all your colleagues?
No, I've not had a caucus meeting, but I've spoken to many, many colleagues over the last 48 hours or so. Many colleagues. And I'll continue to. That's an important part of the role that I have.
What's the general feedback that you're getting from them?
Well, no one's happy to see someone who's an incredibly hard-working member of the team go. But when you make a decision that you can't serve in the cabinet, then you can't serve in the cabinet. You need to tender your resignation. That's exactly what happened. I wish her well, and I acknowledge her hard work and her passion and her commitment. There's nothing to do anything else would be simply wrong. It wouldn't be accurate. So that's why I did it yesterday. That's why I'm doing it again today. But our team is a big and strong team that knows and understands that we've got a very complex and very challenging set of circumstances to confront. But they also know, can I say, Alex, they also know that this strategy is working. And if we can just, all of us, every single Victorian, regardless of where you live, what you do for a living, who you vote for, none of that matters. We've just all got to find it in ourselves to get this job done. And there's just 3 weeks to go before we can take a really big step. That's why we can't let our guard down. We can't pretend this is over because we desperately want it to be. We can't say, oh, well, I've got a sniffle, I've got a cough, but I won't go and get tested, or I'll wait 2 days before I get tested. We can't say, oh, well, I desperately want to go and see my mates, so I will. I'll be right, I won't get caught. No, that can't happen. It just can't happen. We've all just got to find a way to see this thing off, to defeat it. And the next marker of that, we hope and we predict, again, subject to everything in between, will be in 3 weeks' time on the 19th of October.
Can we just clarify on Chris Eccles' position? Was his contract up in June, and has it been renewed, and how long will his next contract?
I'd need to check the record. To be honest, Alex, to be honest, I don't know, but I'll have to check that. Perhaps I should know. I would, but anyway, I'll come back to you on that. But as I said yesterday, he's an outstanding bureaucrat, and he has my full confidence.
Have you tried to get in touch with Jenny, just quickly?
No, I haven't spoken to her.
Is your relationship with Caucus over? I mean, you were once reasonably close.
I wouldn't say that. I wouldn't say that at all.
What would you describe your relationship with her
Well,
as like?
we have been colleagues for a very long time, and I have a great deal of respect for her. As I've said, I acknowledge her hard work and her commitment. I don't know many people, actually, even in the business I'm in. I don't know many people who could say they worked harder than her. She's a very hard-working person, and I'm sorry for her, and I'm saddened by this. I wish her well, but she's made a decision, and it was the only decision she could make once she determined that she could no longer sit in the cabinet. I have nothing but good wishes for her in whatever the next chapter of her life involves.
And would you like to see a woman replace her in the Legislative Council?
I was asked this question yesterday, and I was, these are matters for the party, but I think my record, Alex, in terms of the advancement of women in my government and in my party is very well known and understood, and it's something that I'm proud of. So we'll let a process unfold, but I'm very confident that we'll get someone who can represent that very diverse community and represent it strongly and potentially be someone who can make a profound contribution to state politics for a long period of time, of course subject to the will of the people every four years.
Premier, with the cabinet vacancy, it's likely that Ingrid Stitt's going to be the only nomination. Is that somebody that you'd welcome in cabinet?
Well, Noel, I won't predict what the caucus outcome will be. That wouldn't be appropriate. But I've known Ingrid for a very, very long time, and she's an outstanding person, but she is one of so many talented people in our team. When I have announcements to make about that process having come to a conclusion, then I'll do that, and I'll also have some portfolio arrangements to announce at that time also.
Doesn't look like Harriet Shing's going to put up her hand. Is that something that would disappoint you, not seeing Harriet?
It's entirely a matter for her. It's entirely a matter for each and every member of the caucus as to whether they seek advancement in those circumstances. I'm not a commentator on those sort of matters.
Just to clarify, Premier, in regard to the permitted outdoor gatherings, does the 5 include children? Children counted among that 5?
No, it does not. So if your household, so let me come back to you on the exact wording. We've treated infants under 1 year differently, so that's a point of difference. Your household obviously involves everybody in your household, so that doesn't matter whether it's 5, 7, 9. In terms of the group of 5, my understanding is that it would be 5 people. They would be counted. Children would be counted, but not infants. But let me just absolutely double check that I've got that right.
And on swimming pools.
There is some time. This doesn't come in until midnight tonight.
Swimming pools. Does that? I see school groups can use pools. What about swim schools? For say younger kids, are they allowed to resume?
I'm not certain. Let's come back to you on that. The pools, as I indicated, pools are open, but there are some conditions, and some of those conditions may well relate to the groups that can use them and not having kind of crossover between one group and another. Let's come back and provide you with some clarity on that.
With just the 5K limit, sorry Simon.
Yes.
Obviously there was a discussion around the curfew in your late night. What was the character of the discussion around the 5K limit?
No, they're very separate issues. The Chief Health Officer has provided us with advice in relation to the curfew, and he's outlined that in some detail. To be honest, no, I don't think the 5Ks was really ever on the table for this first step, and we didn't foreshadow that. It's not like we've not taken a step that we could reasonably have been presumed to have been taking. There'll be a time for that, but it isn't now. It's not with 400 active cases plus their close contacts. It's not with even 12, 14, 16 cases a day. There's still too much risk out there at this stage. And I know it's inconvenient, and I know that people would love that to be a bigger distance or no limitation whatsoever. But when the experts tell you that it's working and it is limiting movement, it is bringing a sense of control to those, not to people, but to the potential chains of transmission, then you've got no choice.
Premier, just on the
junior sport, is there any prospect you might bring sports back by sport, whereas there might not have, might be less contact or less interaction between different teams? Is there any prospect of that, do you think, as part of that?
Look, I think that it's under examination. Obviously, we've got arrangements in regional Victoria now, and I think that they broadly reflect the approach that we take in Melbourne. So there's a division between contact sport and non-contact sport. There's a division between junior sport and adult sport. There'll then be issues of crowds, issues of facilities, COVID-safe planning. There's quite a bit in that, and I know it's very disappointing to have seen all of our winter sports pretty much turned on their head from the point of view of junior sport, particularly. We want to try and make sure that we can find a normal in summer that we can lock in that doesn't undermine things. But I'm afraid, Cameron, I can't settle on that today.
Premier, just on the outdoor gatherings, if you wouldn't mind.
Sure.
Just to be clear, is it only one other household and it's a bubble situation over the next 3 weeks or so? Like if you meet
no, it's two. It's because it's outdoors. It's not limited to just. You don't have to nominate just one.
Plus one.
Yeah, exactly.
Premier, on Friday.
Once we get to indoors, though, I think that's when you're going to find that it'll be a much more exclusive arrangement. But again, that's not for today.
How was the number 5 arrived at? 5 people gatherings.
The public health team will have sat down and made some judgments about how many people 10 has guided us, for instance, in regional Victoria. All the way along, we've had to make some difficult judgments, and whenever you settle on a number, there'll be an argument whether it's too high or too low. But you have to settle somewhere. So that's exactly what we've done.
Premier, on Friday you testified to the hotel quarantine inquiry that you had that leaving National Cabinet you heard no expectation of Defence Force support in the hotel quarantine scheme. Yet at your press conference on March 27, when a journalist asked, quarantine hotel rooms, how will that work? Will there be guards on the doors stopping? You responded, we'll utilise private security, we'll also utilise members of Victoria Police, and I'm very grateful to the Prime Minister for his offer of support from the Australian Defence Force. Why did you mislead the inquiry?
Well, I didn't, because you omitted a very important word, extensive support. I had no expectation whatsoever of extensive support coming to us from the ADF. That is what I took away from the National Cabinet meeting in very plain and clear terms. I fully acknowledge that there would be in my judgment, a very different arrangement in New South Wales. I detailed why that was the case yesterday. I'll go through it again for you, just for completeness sake. One, cruise ships. Ruby Princess was literally happening at that time. The number of cruise ships, I think Sydney Harbour was rather full at the time, with cruise ships that have been redirected from across other ports. And of course, there's not the insubstantial issue of more international flights going into Sydney than Melbourne. This is not a point of criticism, either of New South Wales or the Australian Defence Force or the PM. If you read the statement that you've partially quoted from, you'll see that there is further reference in my statement, which is a true and correct statement in every way, where I made it very clear that the Prime Minister, at his press conference after the National Cabinet meeting, advanced a more generous position. I acknowledge that, but it did not change any expectations I had about ADF support in the establishment of the program. It was no one had any expectation that there would be extensive support. That is what I've said, because they are the facts of these matters.
And just on the calls for your resignation, do you think those calls are fair?
It's not a matter for me to judge it. I've answered the question. I don't run from problems. That's not who I am. This is a difficult job, but it's a job that has to be done, and I'm determined to get this job done. But I need Victorians to work with me, and I'm so proud that they are. The vast majority of Victorians are focused on beating this thing. So I think that answers your question.
In terms of announcements that you've made regarding sole traders and businesses and all the grants in general.
I'm coming back on the painters. I can't actually answer that, I'm afraid.
My uncle will be very appreciative.
Very good. I'll come back just for the purposes of your uncle, Simon.
Are we at the end of, I guess, relief packages, or will there be more to announce, not including, future
Sure.
infrastructure and stuff?
Look, I can't, Alex, say that we wouldn't rule that out. I'm not foreshadowing that there is one. There's not one that's in development at the moment, for instance. But we'll always be guided by circumstances, and we have been to this point. The other point I'd make is that we've got a budget coming up, and it will be truly unprecedented in terms of the size and scale of investment that we make. And in my judgment, many businesses, most businesses, certainly individual workers and their families, the best form of assistance is to have them back at work and earning. And there's a big part to that. We can underpin demand. That's exactly what we'll do to get the place really firing again, all cylinders. And then beyond that, there's issues of tailored practical support to deal with hardship. And then there's also supports around training, job placement, all of those things. So it'll be a very comprehensive package. That's still a little bit off, but I couldn't rule out that there'll be some further support of different kinds once we get to that point.
Just in terms of the budget, prior pandemic, it did appear as though there was going to be a further write-down and possibly moving away from the surplus. Will previous modelling of where the budget was going to be in June be released, or is that all totally gone now and where?
Well, becomes
you have said yourself that it was in a very strong position, so we can...
Well, no, I think what I said was that the Prime Minister had acknowledged to me that coming into this we're in a very strong position. And I'm pleased about that, but that'll make possible things that would otherwise not be possible, but it's kind of an academic exercise in some respects, like where things are so different, and not just in Victoria, but I'm sure if you ask Josh Frydenberg, he would confirm as well that the budget he's about to deliver will bear no relation to the one that he would have delivered without the COVID-19.
So the chance of getting any kind of modelling of what it was going to be?
I'm not sure what will be prepared as it relates to... So the other thing, well, let me come back to you. I'll ask the Treasurer or Treasury, but of course this budget will now move across not just one financial year, but obviously it's later than what it was. There's let me ask.
Have you got a date for the budget yet?
No, but the Treasurer will announce that soon.
And will the
Just a
Crisis
question.
Council remain?
Yes.
Question for the
And
Health
for
Minister.
so long as it's necessary, it'll be there. And I just make the point, we have a number of different cabinet committees, and that group would normally, that is coordinating ministers, would be known as the Coordinating Ministers Committee. The Budget Committee is the Expenditure Review Committee. There are many different committees that we have. There's the Securities and Emergency Management Committee, SEMC, which deals with bushfires, for instance. It's very rare that you would try and have such a focused attention and have literally the entire cabinet in the room. That's not the way things work. The whole cabinet comes together when it's really important for that to happen, but we always delegate to smaller groups, and then they report back into the full cabinet. There's nothing out of the ordinary about that. I don't think that the entire federal ministry will be preparing, which would be, 35 people or something, would be preparing the federal budget. I'm pretty sure Josh Frydenberg will have a smaller group that he's working with to do that.
Just a question to the Health Minister.
Sir?
Go for it.
No worries, Alex.
Just in terms of your comments about Adam Somurek yesterday, he responded on Twitter, was obviously unhappy about what was said about his time with you. Would you have a response to
No.
his response?
I was asked a question, I answered the question. I'm not interested in responding.
Health Minister, sorry.
Outside gatherings, 2 households. Why 2, not 3? Couldn't contact tracing be sort of be done just as effectively with 3 households as 2?
Look, no, I think it's a similar answer to the one I gave you about 5. Why 5, not 10, not 20, not 30? It's all about making a judgment about what's safe. And sometimes it's a bit like, I think there's a question earlier on about whether I could attribute to any specific measure an actual outcome. So the epidemiological dividend, if you like, for one particular thing. It's very difficult to do that. There's a suite of measures. They have an aggregate impact, just like the opposite of them, if you let them go. So if I, for instance, I think I've made this point a few times, everyone who's argued an eloquent case to me that their industry should be open, if I'd said yes to all of them, and then we'd have more people at work than we would in an ordinary September. So you just got to be really careful, and you have to draw lines and boundaries and lists. And if you're not on the list, you're not happy about that. If you'd like the number to be bigger and it isn't, you're not happy about that, that's fine. I understand that. But these arrangements are, in our judgment, they'll be needed in their current form, or the amended form I've announced today, for, we hope, as little as 3 weeks. And then we can make another big change, because at that point we hope that will be safe to do that. That's because we're ahead of schedule, and the only reason we're ahead of schedule is because people have worked incredibly hard, every single Victorian, and we just got to keep doing that work. We can't. This will get the better of us if we are anything other than vigilant. It will get the better of us. It will be back, and we'll be delayed, and we won't have that COVID normal Christmas and a COVID normal summer and a COVID normal 2021. We'll have something very different.
In terms of, obviously we're now ahead, and the report of the inquiry was coming back around about the same time that we were coming out of the last step, I think it was. And so in terms of return travellers, does the fact that we're ahead of the program change that at all, or is it still based around the report coming back from the inquiry?
My judgment, and again, it's not a sort of binary thing. You could go another way, but I think, on having thought about this quite a bit, I don't think it's appropriate to try and make those final reset decisions, have flights come back before we see the report. I wish it could be different, and of course, as you point out rightly, the timing of that report is later than it would otherwise have been. But at the end of the day, I think we've all been appropriately focused on case numbers and the challenge that we have now. So even if the report had come earlier, I think unless and until we get the numbers right down, you've got to focus on the main problem and then look at other things separate to that, or add to that. We'll get the flights back as soon as we can in a model that is not finalised yet. We just want to see that report, and I don't know what'll be in it, whether it'll have a particularly detailed list of things that should happen or more general principles. There are a number of options there. Health Minister question.
Yes.
Excellent.
Health Minister, you've only been in the portfolio, as you say, for 15 hours, but how are you going to handle it differently with regards to the pandemic than was handled by your predecessor?
Well, I'll be handling it in accordance with the government's policy. And the government has one policy, whether it's a health policy, a economics policy, a jobs policy. It's a policy of suppressing the virus. And that's how I'll be handling it.
Is that any different from how it was handled before?
I mean,
I'm just trying to see where you'll be different from the previous minister. If
well,
that's
I
what's
can't
needed.
speak for the previous minister. I can speak for what I'll do, and I'll be working every day with the outstanding public servants and health professionals and the people who bind the health system together, the cleaners, the cooks, the clerks, the ambulance drivers, the paramedics. I'll be working with all of those professionals to make sure that we suppress this virus and that we then are in a position where we contact trace, we quarantine and isolate where we need, and we keep this virus at the lowest possible levels. We are nearly there. In 3 weeks' time, we will reconsider this and we will take, should the evidence allow us, another big step. The solidarity, the commitment, the efforts that Victorians have put in, the sacrifices they have made has been outstanding. No more so than our health sector workforce. I'd urge all Victorians to bear in mind that we are so close and to respect the work of those health workers, to respect the work that we've all done, stay the course, and we will suppress this virus, and our policy of keeping it suppressed will allow us a COVID safe and a COVID normal summer.
And have you assured yourself that contact tracing is where you want it to be?
Not yet, but give me another little while and I'm sure I'll be getting briefings around how all of those key pillar elements of the suppression strategy will be delivered, because all of government is committed to this strategy. All of government.
Can we ask the Chief Health Officer?
I can confirm for you, Lundy, that we not only meet all the national dashboard requirements, we are going very, very well. Very well. And we are confident that we have the systems, the processes and the people in place to be able to chase this at whatever level we need to once we get the case numbers very, very low. But again, I will make the point because you almost can't make it too often. You can't hope to keep these numbers low unless you get them low. And that's why we have to be as determined to beat this virus as it is to infect one, the next. It's wildly infectious. And we just have to make sure that we are as stubborn as the virus. And we've got to see this thing through.
Just on the contract tracing, has there been any major changes, let's say in the last month, since the team went to Sydney, that we're going to implement?
No, I'm happy to confirm for you that the biggest outcome out of that is that New South Wales will be copying our IT platform. And we're working really closely with them on that. And then beyond that, there's going to be it is a platform, but not a program. So above all the states and territories, there'll be an IT system that can reach in and get information from one state and then communicate it to another state, which will become really important when we start moving around the country more. But I think the biggest outcome, we're very grateful. I think they learned some things from us, we learned some things from them, but the biggest outcome was actually the subject of National Cabinet discussion at our last meeting, and that was that the CRM package that we've put in place, we're going to work really hard with New South Wales to make sure that we've got the same system. So they're probably going to take the system that we're building and have built and try and run it up there, which I think is fantastic.
Premier, just one more. On the travel restrictions to the Northern Territory, just
Ronaldo,
if you
you
go
say the Northern Territory.
from Victoria to the Northern
Yes.
Territory. So our understanding is you can't travel if it's just for tourism, right?
I'm not an expert on the Northern Territory
No,
restrictions.
no, travelling from here, from Victoria to the
Yeah,
Northern
to
Territory.
the Northern Territory. That's
Yeah.
not a function of Victorian restrictions, though. That'll be a function of restrictions in the Northern Territory.
Okay, so we don't have any restrictions.
Our borders
for
are
people-
open. Our borders are open.
Okay.
So you can travel,
Mhm.
but it's not the leaving that's the problem, it's the arriving.
Right.
What's their framework, whether it be in Brisbane, Adelaide, Tasmania, or indeed the Northern Territory. If you want me to follow up for you, I'm happy to speak to my good friend and recently re-elected Chief Minister Gunner, and he can provide us with any details that you need. Sorry?
We can do that.
Good. Excellent. I'm very pleased you could do that. That'll be... Okay, there'll be no more items, no more matters will be taken on notice anymore. I'll just leave it to you to work it out. On that point, there's painters, there's infants versus kids, and there are a few other small issues, particularly the industry breakdown of the 127,000 and a few other those matters. Apologies for not being able to answer all of those necessarily from the podium today, but we will chase them up for you. If there's no other issues, I will see you all tomorrow. Thank you very much.